Good afternoon, colleagues. We are, this is our wrap-up before our markup on the budget for this year. Grateful for all the work that everyone has been doing. It's a long, and we're almost there. A couple more, about a week and 2 days. But we'll turn it over to the manager, and then I think we've got I don't know if there are any framing remarks. We will go to our Fiscal Affairs Advisory Committee. And so, Ms. Burgess, if you're ready, then we will start with you, and then we'll turn to the manager, if that's okay. Go ahead.
Yeah, that's great. Thank you so much for the opportunity to be here, and I really appreciate all the work that you guys are doing. We on the Fiscal Affairs Advisory Commission have been watching the videos, and we get to watch it on higher speed. So I'm a 2X stan personally, so we do know all of the hard work that you guys and that staff are putting into this budget season, and really appreciate that, and appreciate all of the feedback that we've had from the public. Again, we on FAC are watching these videos, we're watching the hearings, we're listening, we're reading the articles, and hearing all of these various things that are happening. And it's great to see that our democracy is robust and people are participating. And I thank you personally for the opportunity to come vote early, which is easy in the Bozeman building. So the Fiscal Affairs Advisory Commission met a few times over this budget season to discuss the budget, and we met last Thursday on April 9th to finalize our recommendations to the board. So, and I've sent that to the board members, and there's a there's a slide with a very brief overview of our recommendations, which I'll go through very, very quickly, but please ask questions and let me know if we can provide any more detail. So next slide. This is our quick agenda. I think I did the first one, hopefully well enough. And I also would want to give a huge appreciation to the staff support of our commission. We've heard other commissions claim that they have the best staff support, but I think FAC wins there. Okay, next. Okay, so I want to emphasize FAC, since I've been on it, and it's been a number of years since I've been on FAC, and that I've been on FAC, and we have never voted before on future-looking recommendations. We generally vote on recommendations that are specific to the proposed budget. But this time we came around to saying, actually, we really want to have a vote and officially recommend a few things that are more forward-looking than this immediate budget. So first of all, public facilities utilization analysis. Some of the big headline things, multiple of the big headline things that have come up in this budget involve how well we are using and how much people are using the facilities that we have. And when talking to staff, we realized that sometimes we don't have a good handle on how much facilities are being used. For example, community centers, how much are they being used per square foot, per the type of offering they have within the community center? How much can we compare apples to apples? And based on their location, some community centers are really close to population centers, others are further away. And I think if we could look at that data, we would start to notice some trends and start to find out some information that would help the budget and service delivery. And we think without that data, we're really hamstrung in making some of these hard decisions. And I should add, some of the proposals in the budget close public facilities, and real estate is really our moneymaker here in Arlington. We've got great real estate values, so if the county's gonna own something that's gonna sit there empty, the opportunity cost on that is high. So we think public facilities utilization analysis is really important. And we recommend that we tackle that in some sort of way, public way. We're happy to help as FAC. There's also the Joint Facilities Advisory Commission, JFAC, which exists and might be able to be used here. Second, overhead and county-run programs. This really came out of when we were looking closely at the gymnastics program. We realized there's a privately run similar program not very far away from the one the county runs. And the overhead that we end up paying in our program looks like it's higher than the gymnastics program. And I think there's an opportunity there to say why. There may be very good reasons why, but there may be other programs like this out there. We're talking a lot about gymnastics specifically in this budget cycle, but there may be other programs that suffer from, that have the same component, that there are more administrators over it than might be justified. And so looking at those and being explicit, and when you look at the budget document, you don't always see, in fact, you rarely see the number of administrative personnel versus the number of frontline personnel. So breaking that out and looking at it that way just will help us find places where there might be savings or might be areas where we can increase service delivery. Thirdly, housing. Housing is obviously a very important issue for us all to tackle, and we make significant investment in our housing and affordable housing stock. However, it's a regional problem, the lack of housing, and we felt that we didn't have a very regional context to looking at our investment compared to our regional neighbors. And so this is something, and this is something you can really put back on fact to come back, because this seems very much in our wheelhouse, working potentially with Housing Commission and others, but we want to look at how our housing investment stacks up to our regional neighbors, what we're actually spending here, and how that compares to what people have committed to do under COG and whatnot. And then, now I'm going to go faster. We wanted to really emphasize our support for Arlington Public Schools, even though we also support the proposed allocation to APS in this budget, which is slightly less than it has been in the past. That's because we see that the pressures the county is facing are really county-side pressures and not APS pressures. APS is looking at declining enrollment and some other things that are making their budget, while it's very difficult, somewhat easier, and the county is feeling all of these other challenges. We do, on a forward-looking basis, want to emphasize that support for APS is important to the commission, and that APS could continue their work to make their budgeting process more transparent and easier to understand. Not the process, but the budget itself, more transparent and easier to understand. And then finally, we are always very happy to talk about performance measures. That's really because we as a commission are often comparing apples to oranges and saying, oh, there's library funding and parks funding and DES funding. How do you compare all of that? And it is a lot easier to compare when you're looking at how much will this dollar get you closer to any particular goal, or where there might be savings where we're not living up to service delivery or overspending for service delivery. In this particular budget season, we saw a number of really big things proposed that were justified by performance measures that we don't see in the budget. So we talked about, for example, again, talking about gymnastics, because that got a lot of time. In gymnastics, we talked about facilities utilization and fee recovery, cost recovery. There's no way to find any of that data in the budget, and if that's driving decisions, well, maybe those are the performance measures that we should be seeing in the budget document. If we see a performance measure as the justification for a decision, that's probably a good indication that that's a good performance measure to put in the budget. And put in comprehensively. So if we say that this one community center is underutilized, well, let's look at all the community centers, or this one library is underutilized. Let's look at all of them. Okay, next slide shows us the specific recommendations related to this proposed budget. And I have to say, as a commission, we were all geared up. We knew this was a very difficult budget cycle, and we were all ready to have lots of recommendations about what was proposed, and we were really impressed by the work of staff and the manager to come in with a proposed budget that followed the guidance of the board and took a really difficult situation and mostly came up with stuff that we supported. I will say that we had some recommendations that we support that would change the budget. So a few would increase spending. The biggest one being that we would like to see, we recommend that the county figure out a way to maintain the gymnastics program with some changes, whether that be increasing fees, cutting that admin staff, figuring out a way to get more revenue out of the gymnastics program by having, programs over time more often. Whatever it needs to be, we think there's room there to not have it be $1 million-ish net tax support, but to keep it open because it is wildly popular. We also think it's very important to keep the restrooms open. We think that those parks are actually very well used in the winter. We're coming off of a winter where they may have been less used, but there are plenty of times when it's 90 degrees in April or 60 degrees in January, and you see more use. And we think this is an issue that particularly hits hard for women, for parents of young children, for people with certain health conditions and disabilities. And it's such a small amount of money to hit vulnerable populations hard. And then the last increase to spending, we thought the proposal or the ask of the Community Oversight Board was reasonable to increase their spending. This is something that the board supported establishing after 2020 and the Black Lives Matters protests and all of the discussion around the need for oversight of a police department. And we think it needs not to be just a one-time talking point or a checkbox exercise. It should be funded appropriately. On the other side, you're very well aware of it has to be a balanced budget. So we had a couple of recommendations to decrease spending. One is to look at one-time allocations to AHIF. So there was carryover one-time allocation to AHIF. And I would like to underscore, this is not to say that we think there needs to be less of a commitment to affordable housing. It's more looking at the fact that AHIF has the funds there in case projects were to arise in the next year. We didn't think the one-time funding, we thought the one-time funding might be a good place to look to cover some other costs, and we do think that we should keep the ongoing funding there. The healthcare premium, we noticed that for county staff, employees with healthcare plans for one person get more of a subsidy from the county than healthcare plans that cover more than one person, which includes families with children. We thought, seems like it would be fair to just cover everyone equally, which also, if you cover everyone at the family at the 2+ level, is pretty significant savings. And then finally, we looked at ACPT's funding request or proposal and saw that there's a 10% increase in non-personnel funding for ACPT. That looked like a great place to find the money you need to adequately fund the Community Oversight Board. And then we had a couple revenue neutral recommendations. One is CPHD planner position, freeze it instead of eliminate it. I thought this was important because it sends a good signal to the business community and the development community that we are serious about making sure development happens and gets reviewed appropriately in Arlington, but it also recognizes that in this economic climate, we're okay not having them for this year. And then continuing to hold the accelerated Barcroft paydown. I think that maybe having the money on hand in case any of the uncertainties come up, not in our favor, is a good idea. Next slide. Then the board had the commission had a few future considerations for the board and staff to consider. These are not things we voted on, but the first one is over-engineering, which we've said a couple times before, which is we have some projects seem to be A+ level work, which is great. We love A+ level work, but maybe we could do A level work and save some money and get more work out of it in the end. And we have some examples in our report. 2, collective bargaining. We noted that the levels of pay increases for collective bargaining, if you compare it to our neighbors, most of them had big jumps at the beginning of collective bargaining that were kind of catch-ups, but then their raises sort of came down to something more like inflation. And it looks like that might not be the trend in Arlington. So looking at it that way, that maybe we don't need to do a catch up every year. That's really impacting the budget. And then the last two, we think that there could be a more proactive approach in AED to commercial real estate. And we noted some areas for VDOT follow-up that could get some things on the ground, improve service delivery for things we've already paid for. And with that, that is the very high-level summary of what we as a commission have worked very hard for over this budget season. And I'm happy to take any questions you guys have.
Thank you, Ms. Burgess, for your leadership and for the commission's input and thoughtful additional work this year. I'll open the floor to colleagues. I'm willing to start, as often, but so first, I don't know whether it's to you, the manager, I'm a little unclear on the recommendation on the Barcroft prepay hold. I thought it wasn't in for the next budget year and the subsequent budget years, but I could be wrong. Do you know the answer to that question, or should I know?
When we proposed the budget, we didn't, at February 21st, we didn't make a recommendation on that $5 million. Subsequently, in the mid-year memo, we did recommend that that money be used to try to assist with the contingencies we needed to balance in 26 and leave some money behind in the contingency for 27.
Got it. So that applies to the budget that's 26. Is there a recommendation for a Barcroft hold in 27?
Yeah, that's
There is.
essentially it.
5 million again.
No. That it's washed away and goes into the contingency.
Got it. Okay. Thank you. I just was trying to sort of understand. And then a question for you, Ms. Burgess, is helpful to hear on the Community Oversight Board balance and your insight on the non-personnel funding. It sounds like the commission as a whole had some appreciation for the NACOL sort of, there is advocacy that tries to peg the IPA and Community Oversight Board budget in some context with the police budget. I am not informed enough to know whether, I have looked at NACOL in the past, but would you say that the commission had some interest there, but really tailored it most to the non-personnel costs? Can you just say a little bit more about, if you recall, and you're thinking amongst the commissioners as well as yourself, on that particular balance that we're seeking to find between funding the Oversight Board and the IPA and also the police budget?
So I would say that we didn't get into the details of that. This is something where we're looking at the budget as a whole. We're not the experts really on the policing. And the reason we were looking at the non-personnel budget is it just seemed to go up a lot, especially compared to other portions of the budget. And it seemed like an area where you could, with a 10% decrease in that, you could fund a 1% matching of the police budget or
Sure.
something along those lines.
Got it. That's helpful to gain that context. Vice Chair Coffey.
Thank you. Yeah, I appreciate your contemplation of what would it look like for us to do A-level work instead of A+ level. And I wonder if you have any thoughts on how to get our community's expectations down from an A+ level to an A level. Because I think oftentimes there is that conversation that occurs, and the advocacy and genuinely the expectations of our community is not just that we do good things, but we do the best things and we do them better than everyone else around. And I think as we face budget pressures, this is a conversation we have to be having. But I genuinely don't know how to even bring that to our community, because I don't think anyone wants to lower their expectations.
So I'll give you two examples. One is something that I think the county could actually save some money, is in communications. I very much appreciate that no one wants to hear, I didn't know this change was coming. And so it seems like the county's response to that is doing lots of meetings and having pop-ups and doing this and that and the other. And another option there is to have a very clear process where every change will be posted. And the federal government has this, they have the Federal Register. If there's gonna be a proposal, it has to be in there. You can do lots of other stuff too, great, but it has to be in the Federal Register. And it's, you know, if you work with the federal government, you know that it's got to, if it's not in the Federal Register, you have every right to say you didn't know about it. But if it was in the Federal Register, yeah, you should have known. So maybe there's room for Arlington to develop something like that, a space where everything gets posted there. Everything from the smallest, this curb cut is being replaced, or maybe not curb cut, but you know, this street is being worked on, to the big, we're working on the master transportation plan. But it's there, and everybody knows it's there, and this is where you can look for it. Because right now, it is spread a lot around the county's website, and I'm very involved in, there are plenty of projects that I come across, and I think, I didn't know that was happening.
Yeah.
And so that's a way that you could have a standard process and save some money on the A+ness of how many meetings we have. Another one in the transportation realm is, I do think if you talk to transportation advocates, they rather have things put into place than to wait 10 years to get the perfect version of it. And so if you look across the river, DC has been throwing up protected bike lanes, and they first do it with K-rails. They just get cheap temporary things that they can put down on the street to create the protected bike lane, and then they come back later and they get a better barrier to protect the bike lane. And here it seems like we are less, Vision Zero has been doing some great things in this area, but always for smaller projects. For bigger things where we're like, please protect this bike lane, they say, we will, like Army-Navy Drive. When I first got involved
It's done now.
It is done now, but in 2009, I was told that would be Arlington's first protected bike lane. And you know, the whole street got redone and redesigned, and all of that work needed to be done, but you could have put K-rails and put down protected bike lanes a long time ago. So that kind of stuff.
Yeah, no, I think those are all reasonable suggestions. And from my 2 years and 3.5 months of experience here, I don't know that it's quite so easy to change the expectations. So, and then the other important topic, I think, is around the AHIF recommendation and the $2 million. And I am not aware of, I'm looking at the housing presentation and looking at the money that is going in, and the only $2 million that I see kind of broken out here is the expected developer contributions, which I don't think we can reappropriate to anything else. So like, where did you see 2 million, and can you explain a little bit, and staff can jump in as well, because I see.
I think this was partially our mistake, and I apologize. It was just brought to my attention before this. I should have mentioned it, that we were thinking of the carryover amount, but I think the point still stands. General support for ongoing in AHIF, but where there's one time that we have discretion over, maybe it's not the time to make that.
Okay.
So apologies for that.
No, that's totally, I think we want to make sure that we're also not missing something. You know, it happens, it's possible. So, great. Okay, I'll pass along.
Thank you, Vice Chair Coffey. Mr. Spain, and then Mr. Carantonis.
Yeah. First, let me say, excuse my little bit of tardiness of arriving. Who knew that traffic is going to be busy up there at this time of day? But first, to the fact, I had opportunity to look over your report this weekend and digest it. And I just want to say that kudos to everyone on the team. I see Scott here and a whole host of folks who are part of that. And I actually walked in on one of your meetings just to observe a few weeks back, and I can see that you're working very hard. The areas that you lay out are, of course, many areas that this board has been debating and really considering over the past several weeks. But I will tell you, bringing up the piece about the restrooms was something that, as small as it may seem, your point is well taken. And I brought that up at one of our meetings about the disability community, right? And that, you can choose to close them because you may not get usage or vandalism, but what do you say about our women and our folks with disabilities, even in the wintertime, right? Where do they go? So that's a point well made. And I just want to highlight my takeaway is, the theme around community services, protecting those. Glad that you looked at gymnastics, oversight and accountability. I think the chair asked about how you arrived at some of those recommendations with community oversight. And I would just say again for like the 10th time that, community oversight when it comes to policing vis-a-vis police department itself, the rate of growth should be almost identical. NACOLA is just one entity that has a long-standing, tradition of service in communities. They use a 1% threshold, but generally you will want to see those grow at the same pace. One should not outpace the other. And I think that's, again, just a frame of thinking. When you got to the piece about non-personnel, and you talked a little bit about, I'm just curious to know how that discussion went, because it's not just ACPD. I know you looked at the entire budget, but why did you choose ACPD? Because you saw some areas that, because I think there's a lot of departments, but did you give other departments any looks at their non-personnel spending?
So I confess that non-personnel police spending came up and sort of in relation to COB. Like,
Okay.
if we're going to fund the COB, there have to be savings somewhere else. Where could that be? It does seem a bit natural to say that, one way to look at it is funding of a police department includes all aspects of the police department, including oversight of a police department, and maybe it all should, maybe the money for the COB should come from sort of a police pot. So I don't think we didn't do a deep dive into non-personnel spending across the board.
Great. And could you talk a little bit about, and you did, the public utilization of facilities is something I really want to learn. I think we all need to, I believe our facilities are underutilized, and perhaps not appropriately utilized. For a myriad of reasons. I mean, a lot of that has to do to programming, but I think to your point you made, we really need to be laser focused on the potential uses of some of these spaces across our community. So I really, thank y'all for lifting that up. To be quite pointed, and I brought this up to some of my colleagues, there's 1 or 2 community centers, whether it's where our 55 plus go, or where this Langston or Drew Community Center, where I'm looking to hopefully we can have those places open more for youth to be a part of, and not just for, I love pickleball, but not just for pickleball, because that's not what everyone in the community wants. So I really appreciate that. And again, I just want to commend the entire team for the work that y'all have done. Duly noted, well crafted, and thank you. Thank you, Mr. Chair.
Thank you, Mr. Spain. Mr. Carantonis. And then
Thank you,
we'll go to Ms.
Mr.
Cunningham.
Chair. It's always refreshing to hear from our Fiscal Affairs Commission. It's especially because there is always a measure, a balance between pointing out something that you feel, or at least I detect you feel as programmatically and strategically important. Like you say, oh, wait a minute, do we benchmark the performance? Are we transparent, or do we measure our overhead in delivering programs, etc.? I really appreciate the approach. The problem is that we have to operationalize that. I mean, I need the Commission's advice of how, because this is really the work that happens between budgets, not at budget time. In the particular program that actually showcased the lack of transparency, not the lack of analysis, it was the gymnastics program where, we have been struggling to define what exactly cost recovery is and how it's defined and what comes in the numerator, what comes in the denominator, right? I appreciate the approach there. I need more of a philosophical approach of how to do that. So, for example, would we open an account for each program, et cetera? Some departments do that this way, but there are other programs, like take, for example, Vision Zero, that would would have a different approach. So it's one comp doesn't comp everything, and that's for me a challenge that we go forward. On AHEF, I have to honestly tell you, if there is one issue in this budget that is one of the looming challenges I had, is that one-time money is not anymore available. Therefore, also, even playing with the idea of funding AHEF from one-time money, from serious and one-time funding, is not anymore a viable perspective here. The problem is that the current AHEF fund is going to be running out of funding very soon. I mean, like frighteningly soon. That's in 2 fiscal years from now. And I believe that the Fiscal Affairs Commission would really benefit from some extra information on this, because this is not, maybe doesn't hit this budget, but very, very soon in the budget near you and near us. I don't really understand what the regional benchmarking means. So we have an affordable housing master plan. We have some sort of we have goals there. So what would the regional analysis bring on top of that, except for context and numbers?
Context and numbers. I mean, context and numbers, and also pointing out, I think there is some fear that we could be in a situation where Arlington's making a big investment in affordable housing and none of our neighbors are. I don't think we're there, but there is the fear that that's happening. And that would just kind of be unfair, but it would also have lots of other unintended consequences. And I think if we could do this, just look at the public. This part is actually not the most complicated, and it's something that, as I said, I think FAC could tackle without a lot of staff support. In public budgets across the region, where is everyone investing their housing dollars? And affordable housing is one part of that. And can we lay it out and make it clear where we are in the range of our neighbors?
Okay, just as first reaction to that. If this was true, which it isn't, but if this was true, it would be actually a welcome scenario, that we would do more and we would show vigorously attacking a critical issue for our community and our economy, which is affordable housing, and others do less. So we would build strategical advantages on this. Basically, it's not happening right now. Actually, we are losing some steam because of enormous pressures on inflation, of lack of funding, or easy access to financing, very high interest rates, et cetera, et cetera. I mean, the world of obstacles here is huge and is growing every day.
Mr. Katsounis.
Yes, last but not least.
I just have a direct
On this AHIF.
that I think is kind of aligned with you. Even if that analysis showed we are spending vastly more perhaps than our neighbors on affordable housing, I kind of just wonder though, so what? Are we gonna stop spending on housing and affordability? It's hard for me to see that being the outcome of that. I mean, I think it leads to more regional advocacy and more, making sure other people are doing their fair share, which I think is a different and important conversation. But I think in terms of our budget impact, whether that is or is not the conclusion of a regional comparison, it's challenging for me to see us using that as any reason to reduce our spending in that area.
I think this is, you got it. Both of you together have given almost a rhetorical question.
Yeah.
So, and I know that you care a lot, as does the FAC, about affordable housing. I wonder, I'll give you a chance to answer, and then I'll go back to you, Mr. Karantonis, and then to Ms. Cunningham, but I wonder if there might be some additional, you could answer, but we could also do some additional thinking, because some conversations, there was a regional housing convening. It might be helpful to know sort of how we're oriented wise in terms of our investment relative to other places. I sometimes carry with me a perspective that, they're catching up, but they're way behind, and I wonder if that's borne out by the numbers. So we could do follow-up. I'm trying to get you off the hook for having to answer tough questions at the moment, but if you have them, go ahead.
Yeah.
And then we'll come back to you.
Right.
I was just going to say, I think you could any outcome of this analysis could lead you to different answers is what it means for our budget, but I think it's really important information to have for the budget. And so it's like, let's do the analysis and then we can look at what
Yeah.
the different decision is.
And NVRC has done a little bit of thinking, but go ahead, Mr. Kutunis.
What I was after is to convey the following. What is a problem and a challenge for this budget is actually the size of the housing grants program. So not the brick and mortar, so not the AHEF side, but the other side, which is now at almost twice the size. It used to be on pair. And actually, a one-time funding was used to keep that parity going. The parity doesn't say too much about what actually happens, but it shows, the equal push and equal pressure on the will to achieve outcomes. But the housing grants program is an expensive program, and this budget has introduced now something that is not easily digestible, and that I would like the commission's take on that at some point.
And that is, the recommendation is very intentionally not affordable housing, it is housing. Investment in housing for exactly those reasons and even more. We make lots of investments in housing in different ways. So let's look at that. Let's figure out what's working, how we stack up to our neighbors, what we could do better.
Thank you. Ms. Cunningham.
Thank you so much. I've been privileged to be the liaison this year and really enjoying all the work you guys are doing, so thank you. I had a question for staff, kind of following up on a couple of your points. So the recommendation to freeze instead of eliminate one of the planner positions, how do we, as we go through this week, how do we capture that preference, if it is the preference of the board, and how does that fit into the?
You say it.
Okay, great. Oh, love it. I love an easy answer. So we will do that, I believe. Secondly, on healthcare costs, I think the recommendation to consider different shares of healthcare premiums. I know there's a delay in how that gets negotiated, and then there's the collective bargaining negotiation on top of that. Can you share a little bit about, were a board to wish to make a change here to direct, how long does that take to work through the system?
Yeah, so for each collective bargaining agreement, there are 3. They have different rules, agreements, so I can't give you precise, but that is, would be first of all, to come up with options, and then to negotiate, I can imagine it would be 6 months. We also need to remember that open enrollment only happens once a year in May, and we are required under some federal code that I cannot give to you, that we have to give at least 60 days notice of any change as well. I mean, there's some precision about that, like what we do and not do. So I would, and the socialization of that is quite important. So it's, maybe it could be a 28 thing.
Yeah,
at
so
least
it's never
for
doable in
options.
the same fiscal year, essentially. You kind of have to plan 1 year ahead.
That's right. And to think about the options then how it links up to a budget process. It's like, that's what we'd have to really work that. You guys know what I mean. We have to work that through, because we can't change our May open enrollment. And then if you guys are adopting, and do you guys see what I mean? I'm getting into that. So, but I'm happy to think that through more than just giving you the off the cuff response.
Yeah, and so I appreciate the spirit of it, because I do think healthcare costs, and I know everyone around this table has been really dug in on that, along with all of our peers and all of the people in America, that this is a heavy lift that keeps getting heavier. So I think, as part of our guidance, maybe to think about a multi-year look at getting some of those scenarios and playing them out, so that we can think through that and think about how we can push people to, encourage people to pick plans that are also the most economical for them and for us, even though it's a complicated decision. So thank you on that. And then the third is just to uplift the facilities utilization study. I think a number of us have had that same feeling at other points, but especially this year, in talking about how do we do cost recovery, and that it makes sense that we do cost recovery for a certain program to not include facilities costs, but having a facility that's either open or closed is a cost or a benefit for the community. And so thinking, and I think this might be a guidance issue as well, of how do we get to where we're able to have that conversation, how it's in the budget, and how particularly when we have non-residents, private programs, and rentals, is it different in that case, that it's not the same as like going to a yoga class. So just tagging all those, and then I usually don't do 4, but because those were quick and didn't require a lot. The 4th was the public safety analysis that I know the manager included in the manager's message. We didn't talk a lot about that because we were talking about lots of nitty-gritty questions in public safety, and we still have more of those conversations to go. But I'm curious about the timing of that, and particularly as we've gone through the budget process, is there a possibility that that includes public safety and oversight and diversion in some way? Because I think part of what you hear us juggling is we want to do more preventative and upfront investments that pay off. But as we've seen, even with personnel, we bring a police officer in this year, it will save us twice that salary next year in overtime, but it doesn't save us anything this year. And so again, it's sort of this multi-year look.
Well, the proposal I made in the budget was for $100,000 to look at the question about the difference between brick and mortar investments in some of our facilities, for example, fire stations, whether there is a different way to deliver service in our community, as opposed to building fairly large fire stations, moving to a more dispersed delivery model, which is, as they say, everything old is new, which is the way it was done before. That has some profound implications for our community and our collective bargaining partners. The $100,000 will allow you to just touch on that to a certain degree, and also the same question related to the intersection between police work and also work in the mental health community. So this question about diversion too, and I'm referring back to, I think, a couple of comments that were made by Mr. Karantonis, at least most recently in the last work session. The police practices group, which was born in 2021, is now 5 years old. It had 5 separate work groups that looked at including diversionary approaches, also staffing, community oversight, and he had expressed some interest. I'm not saying it's good or bad, but there's another way of doing this, which is to do a refresh on looking at that. I will just say that $100,000 isn't going to get you a lot of all the things I just talked about. Mm-hmm. So the timing on that really depends on where the board wants to go with that larger question.
And if the board were to direct something on facility utilization, does that also need to be funded at a similar level, or that may be an offline question? But
I'll have to get back to you on that.
Thank you.
Yeah, I think that's offline. We need to work through scope, timing, phasing, and utilization. It will take time to figure out how to collect data, and requirement.
So
no, I just really,
in the multi-year bucket.
And then you want to look over a year or two if you want. I mean, right? There's different seasonality. Like, we know our facilities aren't used a lot in August. Yes. Quote, check. People are on vacation. You know what I mean? So let's get value add, I think, yeah.
Thank you, Ms. Cowan and Ms. Cunningham, for your questions. You asked about 2 areas of guidance. I feel like helping to volunteer you to help lead some of those areas of guidance, because I've shared just a rudimentary, and we've talked about lots of guidance, and we have expanded the guidance that we've done in the last 2 or 3 years much more than prior. I do think it's important for us to try to work in topic and funding together, and the follow-through after this will be key. But certainly on the healthcare financing, I'm particularly interested in that area. Also, thank you to your work as liaison, and to your work leading the commission in particular. You had a brief. I joined you briefly, and happy to share and have Ms. Cunningham lead. I'm also thrilled to see every time there's an additional person added to your ranks. And so thank you for your work in rebuilding. The core group has been working very hard. I find a few more hands make lighter work. So thank you to you. And Mr. Pedowitz, you're here representing, and others are there. So I think we'll pause there. You're welcome to stay. We're going to talk some more big picture budget pieces, but thank you, Ms. Burgess. So what I propose to do in the remainder of the, did you have a question, Mr.
It's going to be directed to staff, but it's not for Ms. You want me to go ahead? I can wait.
Sure.
Fact doesn't need to be here. We can do it later.
Okay. All right. So what I propose to do next is to share it.
Mr. Chair, can I just add one thing that I think the chair may have meant to mention, but Cherrydale Library was not on your list, but I think when we had our pre-conversation, you wanted to highlight that the concept of community spaces was important to FAC. And do you want to say anything there before we move on?
Yes. So Cherrydale Library isn't something that we did a recommendation on, but when we were talking about the facilities utilization, we were thinking about so if you do close it, we have this space that we own and won't be used. It also happens to be right beside a middle school, and as we've discussed, there's lots of attention and interest in what kids are, where they are, the fact that they need third spaces to be in. That was just an example that we discussed, is how we can be using this stuff. And while my mic is on, it would be remiss, I was all prepared to answer to Mr. Spain's question about the diversity of our commission, because I do my homework.
You have been listening.
Good, go ahead.
You got ample lead time.
I know, and I knew it was coming. And I would say that I do appreciate all the members of our commission. We are a fairly diverse commission. I wouldn't say we are perfectly representative of Arlington, but I think we're getting there. And we do have parents of children and young children represented, and we do have a fair amount of engagement, but we're always striving to be better. And we're open to any suggestions people have for the commission, and I believe we have one open spot, so we would love to see more applications, and we love to add.
They have one of the best staff liaisons too, I understand.
And we have the best staff liaison.
I would say that's close to obsequious, but we'll just leave it there. Next, Mr. Spain, you wanted to close out.
Mr. Chair, I was going to kind of sit idly by and let Ms. Burgess exit stage left until, so look, thank you. I've had opportunity to see a lot of our commissions at work. And thank you for answering the question that I've asked to many commissions. There's a lot to say about your recommendations and how it correlates to the diversity of thought that's already on your commission. It's a quick tell-all. And I can't say that about every commission, quite honestly. So, thank you for what you do. Really appreciate that thought that is given, not only as an APS a parent, but also as an avid cyclist and a person who supports human rights. I see your sticker over there. I mean, your team, that commission, board members is one of the best that we have here, and I really appreciate your work. But since I have the opportunity, Mr. Chair, I will ask the question that, in your recommendation, you talked about the non-personnel, and I'm going to go to the manager on this one. I think you're going to perhaps provide some information to us today relative to the ACPD's budget and what does either a 1%, a 0.25, or a 0.5% looks like in non-personnel costs ongoing for next fiscal year, correct?
Yeah, I'll be providing some information to you at the end of the day, which is actually 11:59 p.m., but it's coming to you today.
And as you know, Mr. Manager, I'll be up. Thank you very much.
Thank you both, and thanks again, Ms. Burgess, for anticipating the question and helping answer it. So now, what I propose we do is go to the manager for some updates on kind of context on a few brief topics, and you may have less to say than I'm anticipating, but I don't know if there are slides. I don't know. Go ahead.
Well, there might be if you ask certain questions, but if you don't, then we're going to not.
Are you saying we have
won't share the
backup slides?
Well, these aren't really backup slides. They're anticipatory slides. They're very different.
Can you tell us how many of them there are so we know?
I would like to call
we get a
all
prize if we
backup
get to all of
slides
them?
out of order for the level of nerdiness. Lead on, brothers, Mr.
Okay,
Schwartz.
so the first thing we're going to do is we talked about this when I came to you with a summary on mid-year. I'm going to ask Danielle Bush to give you an update on what happened with where we are right now on BPOL revenues.
Good afternoon, members of the County Board. So as Mr. Schwartz mentioned, when we came to the board with mid-year, we noted that we would be back with an update on BPOL revenues, just due to the timing of this revenue source. As you know, these revenues primarily come in February and March, just due to the filing and payment deadlines. Business license revenues are currently tracking to reach the $96.2 million budget. Again, this is our third largest revenue source. We only have about $2 million to go to reach that budget, and we believe that in the remaining months, we will get that $2.9 million. As I've mentioned, the majority of these revenues come in February and March, and the revenues that do come in the few remaining months are typically tied to late payments or the result of audits or just new business filings. And that's all that I have to share on the BPOL update.
Thank you very much, Ms. Bush. Yes, Mr. Schwartz. Back to you.
That's it on that. There are 3 or 4 other things I wanted to go through.
Mr.
But sure.
Can I ask something?
Sure, Mr. Karantanis.
Do you have any reason to believe that we have seen any slowdown? I mean, I understand that you say that they're tracked to meet the budget, right? 100%. So between February and March, because what I have been reading in the economic press is that there is a higher number of bankruptcies, personal bankruptcies, etc., which is not unusual, I mean, but a higher number than average. So that doesn't affect any dynamics of this data. You don't see any slowing
Sure.
of revenue, anything other.
Yeah, that is a good question. When we've come to you in the past, this is, I would say, along with consumption tax, is one of the revenue sources that we have been a little bit concerned about. From what we've seen currently, I don't have any concerns right now with the activity in the business environment. But as you remember, these revenues are from the prior calendar year. So I would say we were pretty conservative with this budget for fiscal year 27. So I'm also hopeful that that's the case for 27.
Right, thank you.
And we'll also continue to work with the Commissioner's Office on the new filings too, to see how they're coming in, to get a pre-glimpse. But yeah, we're still concerned about the revenue source, but through calendar year 25 and the rate of collection that we received, we expect it will meet budget.
Households' expenses are down in this region, and this is concerning. It's not something that we directly track, but it's important for people, so thank you.
Thank you, Mr. Karantanis. So actually, I have a follow-up question, which came up today in conversation with a colleague. I don't know, Mr. Schwartz, or if, as a full group, the mid-year report had us lower a little bit than we expected, and we tend to budget quite conservatively. So do you anticipate, or do you know yet whether we would need additional revenue to close this fiscal year that is not in your projections, i.e. is hotel getting worse? Is meals getting worse? Or is that all covered in your projections? Or are you not too early to say?
Right, so we have, it was 2.5 weeks ago that we presented the information, so we don't have any more precise information than we did unless we've received, I don't think we have for through the end of March. That data probably won't be available for a little bit yet.
Okay, all right. It is possible, but it's certainly not, you don't know, because you did that memo when you did the memo. Okay, onward to the next item on your big picture that you were going to cover.
So in an effort to preserve the integrity of what's left of our mental processes, I wanted to bring up with you in a public conversation this question about the caboose bill, which is at the state level. Again, this year, I can't remember, I think it's the House version, has a 2% one-time bonus for state employees. And we spent a lot of time last summer talking about how we would handle the provision of those bonus funds to our constitutional employees. Where the board came down on it last year, and I'm asking to reconfirm that or whether you want us to do additional work, was that to the extent bonuses were provided to constitutional employees who work for the state, that those funds would be accepted by the county, and that there would be no expectation that there would be additional funds appropriated to match those people who work for the constitutionals who are not state employees. And so I sent you a memo on that on Friday. We're happy to just let it lay there and have additional conversation with you offline. But I did want to let you know that there is one, and I think Richard's going to talk a little bit to the FICA piece of that. Were you able to confirm on that?
I was able to confirm that if we accept the monies and it go just as we distributed it last year to those in comp board seats, that there's no additional county monies needed to cover any other costs.
So there had been some question about whether we had to pick up FICA costs, but we've explored that. So again, I'm not asking you to do anything right now, but I just did want to point that out because I'm desperately trying to avoid the situation we found ourselves in June of last year, where we have to make a decision without not having enough time to consider what's going to happen.
Sure, I'm going to want to follow up on that because my recollection needs to be refreshed a little bit. There's the FICA and the zero, and then there was, in your memo, there was a small amount, so I'm definitely going to want to follow up on that. Ms. Cunningham and then Ms.
Just a clarifying question on that. I believe the caboose bill is about this June, not next June, right? So it would hit us in 26.
That is correct. In order for you, so it would be one time, the money comes to the constitutionals in this fiscal year, in fiscal 26. As a matter of fact, if you look at the language of the bill, it's sort of strangely worded. It says June 1st and then June 15th. They're making sure the money gets out by the end of June. So that would, in other words, if you wanted to do something, now is the time to signal that you'd want to set aside one-time funds to meet that additional need, where there's no way that I think we would be able to get those funds out the door probably at the same time, but we'll have to see.
Yeah, so I think I would remain where I was last year as one board member, that we should not turn down money from the state, even when it's really challenging, the way it was written, and even when we tried to help them write it better this year. I think we should continue to help them write it better, and I think we should take the money that's offered, but not create additional expenses. And for those departments that are affected, I would ask that they plan that way in the budgets going forward, because this is now 2 years in a row. In the prior years, it was a different problem that was more easily managed. But and I don't know how you want to do that, but for those affected departments, is their comp a little bit lower and there's a bonus pool, or how we do it? But I think we should have planned for it this year, and we should definitely plan for it next year, and we should keep trying to get it fixed. But we should not say no to any money from Richmond, because they're really rare about sending it to us.
Thank you, Ms. Cunningham. Ms. Vice Chair Coffey.
Yeah, I'll just insert snarky comment about whether or not the Commonwealth will have a budget by June here.
I mean, the history of local governments criticizing state governments is as long as the Republic. Let's just say that. And in the right world, those with the most incomes pay the most taxes. So before we weep, let's just take that and pause for a moment. Onward to our next issue, tax rates change, I believe.
Yeah, I think I'm going to,
Rhubarb.
who has the slide? Is it, okay. I'm going to ask Emily Hughes to pull up the slide. This is meant to summarize questions that you were asked, just so that the public can see the options that were associated with what you advertised on the real estate tax rate.
All right, so this slide will show
Ms.
you.
Bush, you could probably just lift your microphone just a touch. Sorry to catch you at the wrong moment, but that might help you. There you go.
Sure. So this slide right here, as you can see in the orange column, is what the county manager had recommended. He recommended a 1.5 cent increase to the tax rate. The county board had proposed a 2% increase to the tax rate, and that's the column you see on the far right. And then in between that is a 1.75% increase to the tax rate. For each of these options, there is an ongoing and a one-time column of, again, confirming total revenue that would be added. So for the 1.75% increase, you would see an additional 2.3 million in ongoing, and then below that 1.2 in one time. And then same for the additional 0.5 cents. So it would be up to the county board on sharing that, but again, confirming that is the total revenue.
Thank you, Ms. Bush. On to the next other questions from colleagues. We will certainly we've had discussions, we'll have additional discussions as we move towards markup, which will be Thursday. But go ahead, Mr. Schwartz.
I wanted to give you an update on the Personal Property Tax Relief Act option generator machine, which at this point is up to 7 million options, but we're going to display for you only 7 of them, which we have provided back to the board. And I'm going to let Danielle go again.
All right, so as part of follow-up, as you all saw, we had laid out an additional 7 scenarios on top of what the manager had already proposed to essentially reduce our net tax support contribution towards the PPTRA relief that we provide. Most recently, we had added scenarios 6 and 7. So as you can see under the description for the allocation, under the scenario description here, you can see that provides a brief description of each of the scenarios. And then off to the far right, it will show you any additional revenues that will be generated from accepting any one of 7 of these scenarios.
Thank you, Ms. Bush, and I'll just speak a little bit to that. I believe that both, not listed there, but I believe that both scenarios 6 and 7 would be implemented over a 2-year period. Is that correct?
That is correct.
And that would be sort of splitting in half the relative burden that would come, or is there a specific process, or do you want to get back to us?
Both scenarios 6 and 7 would be placing a little bit more of the burden, a bigger jump, I would say, in fiscal year 27, and then a smaller jump in fiscal year 28. There are some of these scenarios that try to split the burden in half. And then I would say that the other thing to pay close attention to is just for the different scenarios, some of them are sharing the clean fuel and the conventional percentages to equalize those, and others are splitting that into 2 years.
Thank you. I do recall that, and if I now remember, those are the numbers of ongoing that's available for the first year, and there may be some smaller amount in ongoing savings. We are perpetually at risk of putting ongoing savings into future budget years, but this is actually a case where there would be at least some savings that would accrue in the subsequent budget year.
Correct. And the goal for all of these scenarios is to reach fully net tax support neutral, meaning 0 additional net tax support by fiscal year 28.
Great, thank you. Colleagues, for awareness, I don't think I've articulated this. Getting back to, what I recall of the different pieces of tax attributes you want from a tax system, I think there's a certain simplicity to scenario 6 that differs from scenario 7. There's also the clean fuel piece. But I think it's important to note that this is, if I'm not mistaken, this is the tax reduction caps off under state law at $20,000. And so I am not unduly wedded to scenario 6 as opposed to scenario 7, and would welcome folks' thoughts. I do hope that we'll also be able to provide just a touch of deference on the simplicity of the tax if we can. So other questions on PPTRA? Ms. Cunningham.
I mean, do you want people to share where they are? Is that what you were fishing for? No? I mean, happy to.
Sure, go ahead.
Yeah, I would say for me, schedules, I'm really glad to see us doing this. I think this number has gotten bigger over time, and particularly in such a tight year, this is a great place to rebalance a bit. And so while my mathematical mind went to scenario 5, I recognize sometimes it's better to do a 2-step. So I'm fine with 6 or 7. I think I might have done 7 in the absence of the fuel price increases that are drastic. I think given that and how they disproportionately affect folks, 6 seems like a perfectly reasonable.
Great, thank you, Ms. Cunningham, appreciate it. I'm willing to hear from others, but you don't have to. I see Mr. Spain.
Just for the record, I'm going to land on Mr. Scenario 6. I think it's well balanced given the moment we're in, and I think this is also over a 2-year approach, so I'm solid on 6.
Great, thanks. And
for the record, Mr. Chair.
Okay, thank you. And we'll come back to it. So, I do still think it's very helpful to share these thoughts out. We will come back to it on Thursday, and colleagues, I think I see no other lights, so we'll go forward. Next to, we had a little discussion earlier today about WMATA, and we had some questions of Mr. Freeze. Even we didn't let him off the hook just because he was a new parent.
He's here too, virtually.
Definitely not going to do that. But go ahead to you, Mr. Schwartz.
Yeah, so Mr. Freeze spent some time on this last week. There were 2 pieces, well, actually, there's 3 pieces related to WMATA funding. The first is we are not sure what the state is going to do. So we're hoping that they do this patch for 2 years. If they don't, then
Hoping for 1 year.
yeah, we're hoping for 1 year. And if they don't do that, we're
hoping.
We'll be back. We're just going to keep hoping. We had, and I think he went through the details on this, a readjustment made in the way the calculations were done for each of the jurisdictions. We included that as part of the proposed budget, and we can talk about the details behind that. I know he covered that last week. We're happy to go further on that. And he also, there was a one-time savings that came from additional conversations with WMATA that he talked about, where we have added, I think it's $1.4 million of one-time funds to the table. But since we went over that fairly quickly, we're happy to spend some more time on that if you would like. If not, no.
Ms. Cunningham, you raised a question. I think
I
that's
just
all.
had one question on the WMATA one, which is whether, I think it was listed as all one time, and what's the logic of it not being ongoing?
So the amount that I included in the proposed budget, that was assumed to be an ongoing savings. Okay, so that went to that line. The one time, I'm going to phone a friend, Jason, if you're online here. You can go through the details about why we were treating that as a one-time adjustment.
Man, that's,
Yep.
he just pulled them up.
Sure, I'm here. Good afternoon. Can you hear me?
Yes, go ahead.
So the reason we're concerned mostly one-time in nature is because the factors that were determining this additional funding of the 1.8 million that we're bringing down the budget by were due in part by actions Maryland requested in the budget for fiscal 27. And these are things such as deferring bus service and just deferring some of the service that Metro is going to implement this year. And so all of these things are budgetary action that will take place most likely in fiscal 28. So they're just one time of pushing actions that Metro will be taking down the road. So as opposed to being ongoing where the service is going to be canceled or will not happen, it's just going to happen at a later date. Does that make sense?
It does.
It works for
It's
me.
also the sweetest clarification we have.
Yeah, and I think all questions in addition, when you have that newborn, are clearly out of order. Thank you, Mr. Freeze, so much for getting, I forgot that Maryland piece, super helpful. I hope you have a good afternoon is my 2 cents on that. Mr. Schwartz.
It's the evening that's the problem.
Yes, that's, amen.
Okay, so 2 other items we wanted to update you on. I'm going to go and flip the order a little bit. We received last week, we were wired an amount, and I don't have the precise dollar amount, someone here at the table will, a little bit over $1.4 million that we received for a lien that we had placed on the owner of the Keybridge Marriott property. And I'm just going to say that when we went through that entire process, and there were a large number of people involved in that, it is a very unusual circumstance in Arlington for us to have to do what we did. It's just we had to step in the place of the owner and demolish that property. And we did so with the understanding that there was a certain level of risk that we would never see the money again. But we got it. And that's thanks to everybody who was involved in that. I had included in the mid-year memo an estimate of around $2 million. It's actually $1.4 million, so that will adjust a little bit some of the calculations that you see about what's available in the contingency. But that's a good news story, and I think that we're, again, very happy about working with the equity partner there. I think it's Mac Realty. I'm going to get the name wrong, but they did pay what they owed us. The last piece I wanted to spend some time on, again, is something that we will not have a precise answer for you, but we did include, was it 1.2 million, I believe, in the proposed budget of one-time funding for potential buyout costs for employees who might be affected by personnel cuts. So each of those employees, and a significant number of those employees, were associated with the gymnastics program and also the Cherrydale Library closure. There is not a one number fits all employees because it depends on the tenure of their service. So it's very, very precise calculations. So I cannot tell you right now, because I don't know what the board is going to decide on some of those programs. But if you decide to restore some of those positions, that number is going to drop. And I can try to give you a better estimate once we have more information on that.
Thank you, Mr. Schwartz, for that. With that, colleagues, I would like to open the floor to sort of a round of questions. I want to suggest that if we do end before 4:30, you can corner DMF in the next 50 minutes also to ask your questions. And so feel free, let's do the rounds. Let's get as many questions that are out there in the big picture going. But I will just name a few issues that are there. We have a few gymnastics advocates here. Directionally, want to strike that balance between sharing all things that seem likely and being over exuberant. The board's direction that we are likely to pursue is to do fee increases that will not be insignificant, but we are not in a space where closing the Barcroft Gymnasium is our plan for this coming year. I think hopefully that is a reasonable thing to say now. I did not feel comfortable when we had 150 folks sharing because we hadn't done enough of the thinking, but that is on gymnastics. There is a question with respect to recreational fees that I ask colleagues if individually or if I do think there's some detail that we have left to work out on that one. With respect to this Cherrydale Library, we are similarly not inclined to close the library. I don't think it's crazy breaking news, but it is also, I think, reasonable for us to share that. A big picture that will impact us in the coming days is our partnership with the schools. And we had a work session with the schools, and we're mindful that I think that there's a balance that we seek to strike between partnering as we want to and some of the unique challenges and circumstances of this particular budget year on the county side. I will say, for all colleagues' awareness, budget guidance on this seems useful to me, and so the details of that guidance we will have to work out. And there is still some work to do to work out all of the pieces of it. I'm just trying to cover the big picture. There's also a question on sheriff's compensation that we continue to work on. And I'm grateful to DMF for what seems like 24/7 work, and mindful there's lots of work yet left to do. The only other thing I want to name before turning to opening for colleagues' thoughts is that I think I've got this right, but I want to be sure. Housing and the housing grants, there's some technical pieces to the online system that I think are still coming. That's sort of maybe DMF. It may also be, something that Ms. Cowan, I see you coming to the rescue.
So in terms of the specific issue of implementation of a wait list, they will be ready certainly by October 1st and are not concerned about that. With the allocation of one-time money that's in the proposed budget and the work they have underway, they are confident about that. And that was triple confirmed by me this morning, so anyway, I'm not sure if that's helpful or not, but if that's the genesis of your question, Matt, or
it sure is. Thank you. Thank you so much. Let me see if I understand, because we were looking at a delta 1.3 to 1.7 million, and yes,
Oh, you got a backup
and just
slide. Good
for
job.
Is this your first backup slide, Matt?
It is, and I like to think of myself in some ways as not a total nerd, but now I know that I am.
Welcome to the club.
Sure. So that sounds sort of incredible, the phrase, is this your first backup slide? We'll just keep going. So in the budget is the 1.3 for October 1st. Is that right?
No.
No.
No, it's
All it is the July 1st, 697.
Right.
So without being able to.
Let me see if I understand, and this is my first backup slide, so you guys will get it better than I. Zero in the budget. So the 1.3 would be to get us to October 1st, and we believe we have the time to set up the system. And I see Vice Chair Coffey has been interested in this, and Ms. Cunningham, but let me just ask this question. Is it a question left? Other than the system to take care of this, are there other transition policy issues that we should be aware of or not on this?
So DHS has been working, I think we described this during the work session. You guys have heard this conversation and other conversations we've had. which is the prioritization criteria for people to get off the wait list, right? And the first criteria likely will be those on continuum of care, right? At the risk of immediately losing housing, that kind of thing. And so how they get pulled off the wait list. So we can be back in touch with you on that. I think Anita, Nicole described that during the work session. Be happy before anything is, right, finalized, that you guys would be made aware.
Thank you for that.
Does that make sense?
It does, mostly, and I recall a number of 140 or something of perhaps a little bit of case drawdown, but I will benefit probably from offline and more detailed. It leaves me in a space, I want to serve equity and serve folks most in need in line with the history of the Housing Grants Program, but because of the technicals, I am currently in a space where the 1.3 million for October 1st is where I would be. I'm happy to be disabused of that position, but I would rather say it out loud because we're getting towards the time period to work further through it. Vice Chair Coffey, I still see your lights and others. I do think this is worthwhile for all of us. Go ahead, Vice Chair Coffey.
Yeah, I think, sorry, this has been a very long process and none of us are at our finest and sharpest, I don't think, at this moment. I just want to confirm, I think one of the things that the board was interested in was kind of the absolute earliest we could, from a tech perspective, have the wait list set up and ready to go. And then I think there's a separate policy question with respect to when we implement it and how many households that serves. And I don't know if there's an answer to kind of the true earliest technologically possible date for the wait list.
I don't have an answer to that
that's
specifically.
fine. Yeah.
I don't believe, well, I'm not sure it's going to be July 1st. So tell me what,
Yeah.
I need more, what are you guys thinking versus us just sort of,
Well, and
what are you, let me know the options that you're trying to, are you trying to do July? Are you trying to do May? Are you trying to, that's what I need your.
Got it. Okay. And I will say, at least for my part, and I'm happy for colleagues to chime in. I am not interested in July. I think I am somewhere between October and January. And I think it would be for me a critical factor to learn whether if we get the tech capability, and we think October 1 is maybe the earliest we're gonna feel 100% confident we could have it, then maybe for me we're looking more like November, give ourselves some flexibility. What I don't wanna do is commit to an implementation date that is either too early or at risk of being too early, where we haven't put the one-time funds in to cover ourselves, but also the tech side of it is not ready to go. So I'm somewhere between October and January, and if there were a date within that we think the tech implementation will be accomplished, that would be changing my decision at the end of the day, I think.
Thank you. Mr. Karantonis, then Ms. Cunningham.
Mr. Chair, just for the record, I fully appreciate how difficult it is to get the technical infrastructure being available by October. Anything can happen. I don't believe that we can implement anything in the months of November and December. So there are two possible points. Either we do it in October or it is January 1st. For purposes of budgeting right now, I would say January 1st. That's for me the absolute goal. November, December, especially dealing with this kind of a program and this kind of needs, etc. I don't see how we would do this in November and December. October maybe, but it would be extremely tight, and I know how difficult this will be, and it's also a major change in how we deliver the program. So I think that realistically January is our goal here. So, and I would budget for that.
Thank you, Mr. Karantonis. I'll just say also that the budget needs that we're looking at as a whole, even on one time, may be pressing enough that I'm holding a little bit, but I appreciate you raising the specter of the the time of year in addition. And this is our most vulnerable. So, Ms. Cunningham.
Yeah, I would just echo that. I think you are hearing from the whole board, nobody wants to turn on the wait list until we have a technological solution for it. So that takes a whole bunch of scenarios out of the mix. I'm encouraged that staff are feeling like we're very much online to get it to October. I would agree we may need to think about at least making sure I have contingency funds if it spills for a month, but I think we could do that with contingency. And the question I would like to ask is, do we have all hands on deck to do that? Because if there were consulting dollars that could ensure that we get it done a month or two earlier, that would probably pay back both in staff time and in overall savings.
I think they feel like the 100,000 was sufficient. I asked them again. I mean, and with ERD, is, you know, the contractor. When you say all hands on deck, we don't have a huge staff in the housing grants program, just so you all know, and we can't use housing choice voucher staff. So they're all, and they're still processing applications. And we also had the change in the residential duration. So I just
maybe it's a question of like 100,000 is enough to get it done by October. If we gave 200,000, would it be faster? Is maybe the question I would ask. Like, can consultants do it, or is it really a staff bandwidth thing, which it may well be?
It's a combination. I'll follow up for you. Yeah.
Great.
Thank you. So we worked through housing grants and that one-time cost. So those, sorry, colleagues.
Last one, it's right. I mean, we received from Ms. Cohen a memo on utility costs and increases from Dominion. So that's not insignificant money. So that's, roughly altogether between different funds, general fund and utilities fund, about $2 million. So maybe a little bit more than that. So how realistically do we have to include that in our budget discussion? I know that schools is also involved in this, and they are $1 million in. I mean, they have to serve $1 million, about $1 million. They have to calculate.
I think in their work session, I mean, they're monitoring it. Fortunately, we're really blessed to have both Steve Burr sitting on VEPCA, and then APS also has their person sitting on VEPCA, so they're like in the midst of the negotiations, which is, I think, super helpful for both of us. What we won't know is it won't be resolved before budget adoption. And I think in our conversations, DMF, me, we're all regularly monitoring this. We'd originally included 6%. It will not be that number. We won't know where negotiations end up, but it is just certain to go up in that.
The order of magnitude is important here, because this is not minor.
No, right.
Yeah, the initial number that was put on the table was a 30% increase, so it's not going to be more than 30%, but that's what the negotiation is taking place, somewhere in the range between 6 and 30%, so.
And of course, we're in a negotiation, and
So we're.
really struggling for the
their average
Dominion to hear
customer
that,
is
right?
already paying 30% more than they paid 15 months ago.
Right.
So that's this is a serious pressure.
Serious.
Thank you.
And then, of course, as you heard in that what we provided to you, fuel is going up, as is natural gas, and I think we're just very concerned about that, as long as what's happening over in the Middle East. I mean, that's obvious to say that, and I know you guys are worried too, but it's just yet another pressure, right? Which we are going to handle via contingents, or keep you guys posted as we learn more for 27.
Thank you, Ms. Cowan. Ms. Cunningham, is this on the energy or on the housing, or?
On housing, could we put the backup slide up and just make sure I'm tracking to save us some questions later in the week? We are not going to change, we're not going to move to a wait list in this fiscal year under any circumstances. There's a number on there that says July 1 has a dollar amount. That's really $26, right?
Well, so we are short in 26 with the amount that was appropriated by the board based on the run rate for the program. So that's how much we're short. So we needed to take the one-time funds that are available that's part of the hole we're filling for 26.
Okay, so that's closeout, sort of, not really.
Well, it's in
you're
the.
budgeting on 27.
It was in the. Go ahead.
No, it's 27. I think that was when we put together the budget, there was some, remember, there's also the change in the residency requirement and the uplift there. And I think there was some hope that perhaps we'd be able to come to you with a wait list sooner, and then understanding we need to give more notice. So this is needed for 27. The 697 is needed for 27. We underfunded in what was in the proposed budget.
So are those grants that are paid for people who are already enrolled in July 1 because you haven't closed the wait list earlier? Okay, so it's fiscal year, okay.
Yeah,
Just wanted to make sure, thank you for
No,
humoring
I
me,
know
that would have been
it was-
hard to figure it out.
No, I'm not sure we were clear in how we presented it, so that's on us back in.
No, very helpful. Okay, thank you.
Thank you very much. So now we'll do, are there further questions for clarification that people have? I don't see from Mr. Spain, don't yet see from Vice Chair Coffey, but that doesn't mean, and I want to reiterate, if they're technical questions, they can be for sharing, and they can be for individual buttonholing of DMF members right now. What an opportunity. So, and I'm not saying no questions. I'm saying if you have 10, maybe think about that. So, and I honestly think you can get the rest done. So, not trying to be too heavy. Ms. Cunningham, Mr. Karantonis, are there, and so this work session sometimes ends early, and today is one day that it will, and DMF, you are not allowed to go almost anywhere for 30 minutes. So please, colleagues, see if you can find DMF on questions, and we're working through this. And for those 6 to 12 people who are currently watching, there may be other people on 2 times who are watching.
I didn't realize we were on final round.
I'm trying, be nice, and
Can I
final,
ask
go
two
for it.
that may be helpful to the
Go for it. You got
broader
2.
entity? They're both on compensation. So one is for public safety compensation. So again, we're having this conversation about we need a multi-year approach to our public safety compensation to get on top of overtime. Is there any way in that calculation that some of the compensation costs could be one-time, as we're thinking about investing in fire, in police, potentially in sheriff, given that we have a fairly robust, they will pay back within 2 years. I know it's kind of a
so
budgeting.
You may remember our slide from prior years where we showed how we were covering public safety overtime, and it was from vacancy savings. So there's not really overtime budget we can take a reduction in as we bring more police officers on board. There will be actual savings, but there won't be budget savings because we've been covering a lot of that overtime overage in salary savings from within the department. So it doesn't really work to say that our compensation can be one-time in nature because we're going to be getting that overtime savings because it's not budgeted overtime savings. It's actual savings, but not.
Right, so it's actual savings that we won't go over at the end of the year versus, it's very unsatisfying.
Ms. Cunningham, we will bring Josh Folb, and you and I and Josh Folb can make the case, because he does that so often on the school side, I think. But go ahead.
Okay, I'll digest that a little bit. And then the other one, I think there's a question working through the ecosystem, but I think we've heard from employees who are concerned about both the healthcare cost increases and just cost of living increases, that particularly at the lower wage levels, that people may not be able to even stay steady with this coming year. And I know we've done a peanut butter approach to compensation across all levels, as well as benefits across all levels. But given that we have employees who are disproportionately impacted, are there things we can consider, whether it's bonuses or it's differential comp, and kind of how does that get worked through? Because I think we are hearing from folks that are concerned. And that can be offline, but I know it is of interest to multiple board members.
I understand the peanut butter analogy, and I think that's right. Sometimes it's chunky peanut butter, but we can talk about that at a different time. There's a lot of pieces that go into answering that question, and I swear I'm not trying to put you off. It's just that we have to take into account for a family they're dealing with healthcare expenses. Again, not everybody uses our healthcare plan. Okay, not everybody pays the same premiums based on their employee status. So I'm not saying it can't be done, but the analysis requires some fine tuning that I don't think we're going to be able to get done in the time that you probably would want it done. And then there are some policy issues associated with that. We did provide examples, and I think we can always provide you more examples of anonymized employees and the impact with the increase of healthcare premiums, which I think was around 10%. But then again, some people are on Kaiser with a lower percentage. There was different impacts. People were still getting, I'm not going to say huge amounts because it was a 3% pay raise based on where they were in the salary scale. And that itself, this is a flat salary increase because we moved away, many years ago, we had differing percentages based on years in service. So there's lots of different ways to do that.
Yeah, I guess specifically on the healthcare costs, the ask was to update that chart to not just be the premium costs, but also the prescription copays and the co-insurance costs. Because again, we've been hearing from staff members who are deeply concerned about that.
Yeah, I'm trying to think how to, prescription copays, how do you, I'm not sure we had the data to say a typical employee uses prescription. I mean, like, I want to think through how to do it. I think that's a pretty
You might have to make some
intense. Well, yeah, we'll have to make assumptions whether they're, I don't. Okay, we can try.
I mean, usually in the broker, like when we're choosing a health plan, there's usually some of that information available. We can talk more offline. Sorry, I thought it was an easier question than that.
I think what Michelle's getting at, and it's, again, not to be difficult, is there's just so many different variations on that. The one thing that we did do, and I want, give the board credit, was most of you, not all of you, but 3 or 4 years ago, where we adopted a different flavor of a health plan that had higher deductibles to allow people to pay in at a lower premium. So that's always something we can look at in talking with Cigna, doing another plan. But I'll have to think that through, and sort of we'll have to have more of a conversation about how we would do that analysis.
Right, and then just so I understand, though, you're looking for different compensation approaches for different classes of employees then to?
I mean, I think this is a question we asked early on in the process, which is in a time of inflation and high housing costs, how are we making sure that at all of our compensation levels, people are keeping up? Or how do we know if they're not? Maybe even if we're not going to change anything, how do we evaluate that?
And part of the answer, though not the complete answer, was that we do, and I think when Human Resources was here, we talked about we do studies of various pay and grade comp, pay and comp, we call them studies.
Yep.
Correct.
This year, we weren't doing a set of studies focused on a specific area, but we actually, and I don't know if we ever shared the information, we do those studies throughout the year. And then so what ends up happening, and we have this information, I don't know if we've ever shared it with the board, is that, for example, if I submit a classification study to HR and someone in the county manager's office is at a lower pay rate and they get bumped up because of the analysis they're done, that is something that's done and then is built into the base budget for the following year. So there are things like that that are always ongoing that have a certain cost associated with them. And I think I'm going to get the number wrong, but we can give you that information. So that's not something that you specifically budget for. It shows up in the following fiscal year. I'm afraid I'm just confusing the issue, but that's what happens in reality.
Thank you. I do think it's a fair question, and maybe follow-up is a good thing. And with that, colleagues.
No.
Go ahead, Mr. Spain.
Yeah, I mean, it's probably not a question here, but I think for the record, Mr. County Manager and team, I want to associate myself with some of the comments of Board Member Cunningham to the extent we're talking about healthcare. And whatever we can do to learn more as we move forward after this budget cycle, I think I really want to be involved. Why? Because to what Ms. Cunningham said, 15 months of being on the board, I too have heard from a number of employees who are feeling the brunt of our current social economic climate. And so when you have the higher echelon of a government entity or any organization who is not really feeling it as much, And when healthcare costs are going up 10%, but you talked about it, County Manager, where your pay is not keeping up with that, it's off balance. And so we got to make sure that the folks at the bottom end of our workforce are not the ones who are really having to absorb all this weight. And if that's the case, I want to see some analysis, which I think is going to take some time for us to get. Because it's really hard for them. And I know you're aware of that, so just want to say that for the record. And just, Mr. Chair, while we close out this work session, you talked about gymnastics, you talked about the library, you talked about the sheriff. There are a number of areas that we're going to talk about over the coming days that I am laser focused on, and hope as a collective we can get across the finish line, not just what we talk about housing and public facility, utilization, perhaps down the road, how we study that. But it's going to be some long days for us ahead here, and I know we're going to do the best for our community. So thank you, Mr. Chair, and thank you to the staff and DMF for the hard work. I know I've sent a couple of emails probably last minute, and as a junior member on this board, asking some very pointed questions, but they're all for a reason, right? Because I want to learn more, but I want to understand our processes and how we arrive at some of these recommendations that you make to the county board. And I will tell you, I'm still in the learning phase, and there's a lot of things, quite honestly, I think we perhaps can reimagine and do differently in a very innovative and transparent way. So not only the community, but also the folks that work in the government can understand what's going on. Thank you very much.
Thank you, Mr. Spain. Mr. Karantonis, we'll hope to get done by 4:15 at least.
That's probably the suggestion. I just wanted to tell you that actually I'm not known for being always praising HR here, but in that they have been very good and they are recognized across the region. Compensation studies Arlington is very good at doing them, and we should be charging others because they are copying ours and they're using them all the time. So that's the healthcare costs is one of the major stressors, I understand, that has been for this budget, and I'm actually surprised that it was only 10%. We have seen last year that it could be a lot of surprise embedded in this, and thinking about the way forward is on our side, how robust we are with reserves to face the challenges that come from that. That's what I wanted to say.
Sure.
But on compensation studies, we're really good, apparently.
Thank you, Mr. Karantonis and colleagues. I think we have near unanimity on a guidance on healthcare costs, and there's also other pieces that are still ahead as far as what we would consider over the coming days. We do have plenty to do. We're grateful for DMF and all the staff who's doing the hard work to work with us. And with that, I think, in this case, I'm accurate in saying we're adjourned for today.